Good afternoon, and welcome to the first of this week's episodes of the Ask Dr. Murphy series. I hope you're all doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing very well.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions, addressing the latest headlines and our lone U.S. COVID statistic through today, December 2nd. We invite you to submit your questions down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with our abbreviated COVID statistic, average COVID deaths per day in the last reported week were 58. In the same week in 2023, we saw 199 daily COVID deaths. Dr. Murphy, your reaction to those numbers and COVID in the country?
Yeah, it's we haven't taken off with the winter jump yet. That usually starts about now and really takes off in January and February. There's no reason to think that that's not going to happen. But I think the key thing is comparing it to 2023, it's less than half of the death rate. And so this is really great. Because we had in 2023 approximately 76,000 deaths from COVID, still quite a high number, way higher than we ever see for flu or other respiratory diseases for the most part. And so we're likely, since these numbers have been a half or even less than half from a year ago, that the overall tally on the number of deaths from COVID will be less than half of what we saw in 2023. So it's good to keep that in mind.
Very good. And another thing to keep in mind as we get into this respiratory season are the vaccines. Can you tell us about how many people have gotten vaccinated thus far?
Well, we focus on vaccines because prevention is always the best way, because there's three viruses out there that can cause serious illness or death. And that's influenza or the flu, RSV, respiratory syncytial virus, and COVID. We also have streptococcal pneumonia, a bacterial infection that can also be fatal. So you've got these three viral diseases, and streptococcal pneumonia also has a vaccine to help prevent that too. So all these four causes of pneumonia can be prevented or markedly reduced if people take the vaccines. So the good news is that the uptake of the vaccines is a little bit higher than it was last year. So that's going in the right direction. However, it's still only about a third of US adults have received this year's flu vaccine. Even fewer, 1 in 5 or 20%, have had the new COVID vaccine. And only about a third of the eligible adults for RSV have taken that vaccine. That's a really easy one, just one shot. So overall, it's bad, but it's better than it was last year. So I guess we have to take what good we can. And, I think focusing on people who are vulnerable, they have underlying diseases, this is, of course, very smart. But we can get the whole thing ramped down if everybody that's eligible to take these vaccines takes it.
Absolutely. And while we're on the topic, our first submitted question this week comes from a viewer who asks, could you review the preventative measures for this winter, such as the usefulness of masks and those new vaccines?
Yeah, now, this is a really good, very practical question, especially as we're going to start seeing these numbers take off. Remember, the death rate is the last metric to change. So you'll see the cases go up. Sick people will end up in the hospital, and weeks later, the fragile ones will pass away, unfortunately. So the death comes much later, and then it goes away later because it then trickles down. So we're we're at the bottom of the death rate, but the number of cases is probably going up right now. But anyhow, so what do? Prevention is the best thing. I just talked about all the vaccines that are out there to prevent these respiratory hospitalizations and death. If you get sick, it's very easy to make the diagnosis now. You can either go to a clinic or your doctor. They can test you. They can find out what you have because there's treatments for a lot of these. COVID, influenza, and streptococcal pneumonia, the bacteria, all have treatments available. So you want to know if you have something that's treatable and something that's serious. And so that's why you want to know what you have. Now, over the counter, you can get the COVID test, you can get the influenza test. The other tests will be forthcoming within the next year or so, but you can always walk into a clinic to get tested. So do you need to wear a mask? Well, if you have a respiratory infection, you are contagious. So you either stay home and work from home if you can. If you have to engage with the public, you should wear a mask and stay away from people until you're better.
Mhm.
Very, very common sense.
Absolutely. And we have a second question that's about a different vaccine, but on a topic we've talked about a lot lately. So the question reads, Dr. Murphy, do you suggest I get the Mpox vaccine? Should there be a booster? This person has received one dose.
Yes. This person, well, the Mpox vaccines is 2 doses. So this person hasn't finished the vaccine schedule. So this person needs a second vaccine that'll get the protection rate well over 90%, and that person will be protected. So that's great. If you only stick with the one shot, the efficacy is not as good. However, after that second shot, we don't know if you ever will need another shot. So that information will be coming as we learn more about the disease and follow patients for a longer period of time to see if that immunity actually lasts. But for right now, it's for Mpox, it's 2 doses and then you're done.
Very good to know. And before we move on from COVID, there is a very big and very important study that was recently published regarding the risk of cardiovascular events following COVID infection. Can you break that down for us?
Well, we know that COVID it can impact the heart, and we know that people with heart disease do worse with COVID than those that don't have heart disease. So that link is old. It's well known. But I think what's really surprising here, comes from a very large database of over 2,000 people who before vaccines were available or have been followed, and 217,000 control patients who haven't had COVID or reported an infection. And they followed this very large group. This is from the University of Southern California and Cleveland Clinic. And they found for those that were hospitalized with severe COVID infection, the likelihood of cardiac events were increased very significantly. Maybe as much as twice as much as the ones that than the baseline rate for these cardiovascular events, and this goes out for 3 years. So it's just very important results that shows that this prior infection. Now these were pretty sick patients, but they had a lot of cardiac events ongoing for at least 3 years. So this is the risk is really remarkable. And so how do you prevent that? You don't get COVID.
Mhm.
You have mild COVID and don't get that sick. And that you can do with the vaccines. So it's pretty simple. Just another good reason to try to avoid COVID. They also found in that study another thing we knew for a long time, that those with blood group O did better than those with A, B, or AB. So the similar findings from before.
Consistent findings. And as time goes on, I'm sure we'll see more studies looking at COVID and cardiovascular health. So, something to keep in mind. But more big news that came out this week was about a recombinant flu vaccine. Can you tell us how it fared? And also, what does that really mean, the recombinant vaccine?
Well, recombinant vaccine, they're just making the stuff. The current influenza vaccine uses eggs. This is a very old technology and causing egg prices to go up. Even avian flu is making it go up because so many chickens have had to be culled, and you have to use a lot of eggs for this. And this is the more standard way to actually make a vaccine now. And I think it's really good news because it's probably also going to be cheaper. And it's just a technology that's been around for a while. And for some reason, the influenza vaccines, they didn't change the technology for many, many, many years. And so it's just an improvement in the manufacturing of the vaccine.
And did those new vaccines seem to work as well as the old one?
Well, it certainly gives the same or better results in terms of the immunologic markers that are predictive of helping you avoid serious disease or getting infected at all.
Mhm. That is good news,
Yeah.
something to look forward to for future flu seasons and maybe more vaccines in the future as well. But
Hmm.
another story that we have been continuously following is that of the avian flu, which you mentioned.
Hmm.
This and last week, there have been many probes into raw milk with avian flu found inside, as well as that case up in Canada in a teenager. Can you bring us up to speed on all that's happened?
Yeah, so there's at least two cases from people uh, using raw milk. The people that use the raw milk did not get infected, but they tested the milk products. And in two instances, they found that the virus was in the milk. Now we know that pasteurization kills these viruses. They're relatively fragile outside the body. And but raw milk can have listeria. It's a bacteria that has been reported recently in food outbreaks. It's very harmful, particularly to pregnant women. They can lose the pregnancy if they get listeria infection. And you can just get sick from listeria, and here we have COVID in there now. So this is not good. It's just another reason that raw milk you have to be really careful. Now, the incoming administration, there are people in that administration, including the proposed head of DHHS, that believes that raw milk is really good for you. Well, it remains to be seen whether how much better raw milk is versus regular milk. Doesn't seem to have any kind of major impact. But raw milk that's not pasteurized can cause a lot of diseases to occur. And so we have to keep that in mind.
Hmm.
And as far as
And
the teenager in Canada, he reportedly, a young teenager, I don't know if it's a he or she, the young teenager is still quite ill. They've tested the entire family and circle of friends, and none of them are sick. None of them are sick or tested positive. So that's great.
mhm.
For,
Now, our last story for today, which you have also touched on, is walking pneumonia. We have seen walking pneumonia cases here on the rise in the US and among children as well, which is concerning. Can you break that down for us?
yeah, walking pneumonia is a mild sort of pneumonia. It rarely is serious, but it can get serious and can land you sick in the hospital. It's treatable with an antibiotic. Typically, the person walks around during the day, maybe coughing a little bit, but usually not a high fever, and it just resolves on its own many of the times. It can be diagnosed. There are tests to do it. You have to give a sputum sample. And the characteristic of this pneumonia is, though, it lingers for a really long time. It's not a short disease. People have these coughs for weeks and weeks, and then finally come in and get diagnosed after weeks of being ill. So children are, of course, very much a risk, but anybody can get it. It is treatable, it is diagnosable, and if somebody's got a persistent cough, it is a possibility that they have this and they should seek treatment.
Absolutely. One more thing we should have on our radar as we continue to move through the respiratory season. But on that note, thank you very much, Dr. Murphy, for your time this afternoon, the expertise, answering our questions, and breaking down the data.
Great. Thank you very much, Katie.
And thank you all for joining us for this specially timed episode of the Ask Dr. Murphy series. We will be back later this week on Friday with another episode. We hope you all enjoyed the Thanksgiving holiday. And as always, if you have any questions or suggested topics, please leave them down below or at any of our social media in the description. See you later this week.